Another beautiful day, and thank you so much for watching a Well Woman TV, a platform where we bring you health and well-being related issues to help you enhance your health and well-being. So I have a wonderful veteran, my very own guest. We've been on this platform before, and she has a wealth of knowledge. And today we want to dive into another aspect of health, which affects everyone. It affects both men, women, young and old, in different shapes and forms. And most times, it's always good to hear it from another person, especially someone that has a wealth of knowledge. I know on this platform we've talked about it, one or two times, because if you check the videos, you will see them there. But today we just want to hear it from another person. And that person is no other but our very own veteran. She's a nurse by profession, worked all the years, retired, and still looking healthy and in every angle. So I'm going to say, welcome with me, Mamata.
Welcome. Thank you very much. And thanks once again for
You're
inviting me to your platform.
You're welcome. You're welcome. Thank you so much for always joining anytime we beckon on you. So I hope you've been well.
Yes.
Fantastic.
Yes.
Fantastic. Yeah. So today we just want to talk about anxiety. Okay. So an anxiety is something that affects, like I said, both the young and the old. It happens quite often, but the only problem is when it goes, out of control, then you have to look for help or possibly, learn how to manage it. And also, it has some effect, some physical symptoms, some mental symptoms, and also it can affect our behavior. So, with our veteran today, we are going to start with, the very first question that, we want her to help us with. So, Mamata, if you don't mind me asking, your years of nursing, what are the most common signs of anxiety you've seen in adults and in younger people? Okay, and how do they differ between these groups?
Well, with adults have responsibilities, and anxiety is part of everyday life. From the moment we wake up to the time we go to bed, anxiety exists. We cannot avoid it.
Yes.
Because you get up in the morning, you want to check the time. What time is it? Have I overslept? That is anxiety. Am I late for work? That is anxiety. So it's part of our everyday life. Yeah. But with adults, they've got children to take to school, get ready for school. They don't want to be late for school. They don't want to be late for work. And anxiety creeps in throughout the day. In the workplace, they have to please their manager. I hate the word boss. I like the word leader.
Leader.
Because to me, a boss is something who has no
around.
compassion, lack empathy, lack understanding.
Yes. They're always work oriented,
Yes.
Outcome oriented. They don't care any other thing.
Yes. A leader leads you. For a business to progress, you need leadership.
Yes.
Not bossing around.
Yes.
That's why I don't like the word.
The leaders lead with compassion.
Boss. Yes. And understanding.
Yes.
And cooperation.
Absolutely.
Yes. So anxiety is part of our daily life.
Okay.
Yes. You go to the shops. Is it open? That's anxiety. And we don't even realize that this is anxiety.
Yes.
A lot of people misunderstand the word anxiety for a form of mental illness, but it is part of your daily routine.
Thank you.
Yes.
Thank you so much. And you say for younger people?
Yes. For younger people, it's different. Yes. Yes.
Okay.
Yeah, because the younger person will think, well, I have my peer group. Am I wearing the right clothes? Am I going to be bullied?
Whereas an adult is thinking about
and
how
I'd
to
rather
get
think
the money.
more about, earning money, caring for a home, going to work, pleasing your manager, getting to how well do I get on with my colleagues?
And also, do I do the job properly?
Yes. Are they happy with my output? Yes, it's a completely different thing. Like a woman, if a woman gets pregnant, her concern is, am I going to have a safe delivery? Is my baby okay? Yeah.
Okay. All right. Thank you so much. Thank you for that. So in today's fast-paced world, what are the practical everyday strategies you recommend for people to manage anxiety at home or at work without needing medical intervention right away?
Well, in today's fast-paced world, you need more cooperation. You need proper communication, less squabbling. You need to speak to your children and encourage them. Husband and wife, when there's a misunderstanding, try and bring it to a happy conclusion. Don't keep on and on and on because I'm right and this person is wrong. I'm not going to give in. Just try and see.
Resolve issues. Yes.
And try and resolve it amicably.
Yes.
This may be your very last few words on earth.
Yes.
So don't let it be an unkind word.
And like we were saying before we started, we said, we are all sojourners here on earth. We don't even know when anyone will disappear. So once there's that issue, try to resolve it because yesterday is gone. Tomorrow you're not sure. The time you have is now.
Is now, yes. You cannot call back yesterday.
That's it. Okay, thank you so much. Thank you. And also, how does anxiety typically present when someone is also dealing with burnout or chronic stress? And what steps can communities take to support individuals facing both? Individuals facing both, anxiety and possibly stress.
When there's burnout and stress, is when anxiety has seeped into depression. And one example is parents who cannot afford to feed their children. People who have bosses, I wouldn't say leaders, but bosses who are constantly nagging. Yes. It leads to burnout.
Absolutely.
People who are facing divorce, that leads to burnout. Going to solicitors, they are typical people who, they just wreck people's lives.
Yes, but solicitors,
yes.
people think they are their friends sometimes. At times they don't seem to be people's friends,
But they're not your friend. You are their manager. You are their employer. They're not your friend.
They will ask you to
There's a
bring
difference
it.
between being friendly for a
Yes.
person. Being friendly for a person doesn't mean that person is your friend.
Absolutely.
Yes.
Mm. Mm.
Yeah.
Okay.
And when there is burnout, you really need, these people need a person who can understand, a person who can talk to them. You need a good listening ear. A person who could say to you, well, what is happening? And listen. You can even invite that person, let's take a little walk.
That's it.
Somewhere.
Yeah. Yeah.
Let's go out to have a little drink. It doesn't have to be an alcoholic drink. You go out and you just sit somewhere and recreate. Because your brain needs tuning.
That's it.
You cannot overtire that brain. This is your brain is the computer for your body.
Yes.
It needs the same way you clean out, you defrag your computer, you need to defrag your brain.
Absolutely.
Yeah.
Yeah.
And most time burnout occur when your cortisol level is so high. Is cortisol and adrenaline is so high.
Absolutely.
Yeah. It's at a level that you cannot bring it down. So you need a helpful person, not a person to criticize you.
Yeah.
To tell you move on. Move on to where?
Yes.
And to what?
Yeah. Or to tell you I understand when they don't understand.
They don't understand. Yeah.
Yeah. Okay.
Yes.
Oh.
You need recreation. You need a break. I remember going to Boots some time ago, and I had my eyes test, and the optician said to me, "You eat very well." I said, "Yes." I said, "How do you know?" He said, "You've got problems with your eyes, but your eyes are healthy, but you don't rest enough."
Oh, you see?
So I said, "How could you tell?" He said, "You've got tired eyes."
You see?
You see? Yes. So from that, I learned that despite what's happening, I have to rest.
Absolutely.
Because your body needs rest to recover.
Yes.
To regenerate, you need rest.
Absolutely.
Yeah. And that's why sleep comes in.
Yes. In fact, before you go there, just to let you, our listeners know as well, you know, when you have anxiety, like I did say, you might have physical symptoms, it might give you mental symptoms. Okay.
Yes.
So at physical symptoms, we're looking at you having faster, irregular, or more noticeable heartbeat. You know, your heart tends to pound. All right.
Yes.
So you might be feeling lightheaded or dizzy.
Yeah.
Also, you might have headaches. You might have chest pains. You might have loss of appetite. Yeah. At times, you might be sweating. You see your palm. You know, you start sweating. You start, having, like on your armpit and all that, and your palm as well.
You have to get diarrhea.
Yes, at times you have diarrhea.
Dry mouth,
breathlessness.
Yes.
You know,
your hair falls
feeling
out.
hot and even shaky. You know. Yeah. Okay. So these are some of the symptoms you have. You know, which are quite physical and mentally as well. You might feel tense. You might feel nervous. Also, you might be unable to relax. You see yourself pacing all over the place. You're worrying about the past or the future. Maybe something that had happened years back.
Oh, yes.
You're still thinking about it. Yeah, you're worried. You might be feeling tearful as well.
Yes.
Also, not being able to sleep. Okay, not being able to sleep and difficulty concentrating. Yeah. You might even have fear of the worst happening to you. Okay,
that is what anxiety is, a fear.
Yes. Good.
Yes. It's about the future. What's going to happen if I did this? What's going to happen? So you're constantly worried. You're constantly in an anxiety mode.
Yes.
Yeah.
Okay. So now that takes me to, the other question I want to ask you. I say, what role do sleep, nutrition, and physical activity play in anxiety management, and how can someone start making small sustainable changes?
But sleep is important. Lack of sleep causes fatigue.
That's it.
It causes mental and physical fatigue.
Yes.
Your body needs to, you need to sleep so your body can recover. Because a lot of recovering takes place when you are asleep.
Absolutely.
Your brain needs to clean itself and start afresh. If you stay 5, 6 days, 7 days without, you begin to look haggard.
Yes.
You begin to develop early wrinkles.
Look older
You're
than your
not,
age.
yes. Yeah. You're not, you lack thirst. So sleep is important. Our body needs sleep every day. Whether it's daytime or nighttime.
Yeah.
Sleep is an essential part of you being alive and being alert. And your diet is no point taking vitamin pills in place of food. It can never replace
at all
your food. Your body needs replenishing each day.
Yes.
You do not have a car and try to run it without petrol.
Day in, day out.
Yeah. Your body needs fuel.
That's it.
And each
has a role to
play. Yes.
And also exercise is
Exercise is important, otherwise your muscles die. You have to give, the nerves has to send message to your brain to say, get up and walk.
Yes.
If you're unable to walk, there are exercises that's designed to help people who are not able to walk.
Yes.
And this is why you have physiotherapists. And when the physiotherapist has given you exercises to do, be disciplined. You don't have to do a whole hour and a half exercise, but you must at least do 4 or 5 minutes daily. Don't do 5 hours one day and skip 2, 3 days. Exercise means a daily routine of getting your muscles in tone. Because you need your muscles.
You do. Yes. And also for your mental well-being as well. Because you know, when you do exercise, you kind of like unwind, and also it helps with your sleep.
Yes, it does.
Yeah. And it helps with your digestion as well. Just like she's talked about nutrition. So when you have taken in this nutritious diet, they need to, digest appropriately, and also be eliminated. So exercise helps in these processes.
Yeah.
So we can't do away with it.
Yes, it doesn't mean running every day. Sometimes people run. But when you go for a bit of exercise, it's good to walk.
Yes.
When you walk, you take in scenes and sights you have not noticed before. So you're exercising not just you're exercising the brain as well.
Yes.
You exercise your eyesight.
Yes.
Because the greenery is good for your eyes.
Yeah. And you tend to communicate, with nature. You seeing all those flowers, the way they are moving, all those, flies and all those, they all give a kind of sense to you that, nature is actually a beautiful thing.
Yes.
Because if those leaves are there, they are blossoming, they act at their own season. When they are green, they are green. When they turn, during the season. So each season you see them changing. So when you're seeing that, you also apply it to yourself as a human being, that we all pass through seasons in our lives.
Yes.
There are times when things might be going well. There are times when it will be a bit rocky. Just know that that's the season. And once that rocky part goes, it goes back to normal again. So when you understand all these things, it also helps to relieve your anxiety.
Yes.
Okay.
Because I think of the seasons, and I always apply the seasons to human.
Yes.
Because spring is newborn. Summer is your teenage.
That's it.
Yes.
Yeah.
Autumn is your adults.
Yeah.
Mid-adults, yes. And winter is your old age.
That's it.
Yeah.
So the four phases.
Yes, the four phases.
Yeah, in a person's life.
In a person's life.
Yeah.
Yeah.
See?
Mm.
Yeah. Thank you so much. And also, as a veteran nurse, what will you tell someone who feels overwhelmed by anxiety but is hesitant to seek help due to stigma, access, or fear of judgment?
You've got to listen to that person, find out what is causing their burnout, what is causing their depression, what is causing their trauma. Because you must deal with the cause. Don't just deal with that trauma, deal with the cause. Once you are able to find the cause, you have to say to that person, I cannot help you with that particular problem, but I will try and find out for you. Try and find someone who can help you with it. And make a concerted effort to try and help that person find a way out. There are lots of organizations, but unless somebody delve into it and find out and help you out, you remain in that situation. Yes, especially you've got people who've got, as I say, stigma. The stigma is about being mad. The stigma is about mental problem. We all, your mental health is part of your general health.
Yes.
And the first place that gets a bashing is your mental health. And unless you get people who are able to listen to you without judgment, without criticism, you never get help. People must understand, people must not, don't just say to that person, be positive. But the person doesn't understand what you are saying about being positive. Positive about what? If everything is dark, you know, when you find out what really is the problem, then you can gently talk that person into a brighter situation. You cannot do it. You try and find out somebody. You say, I have this friend who's got a problem. I wonder if you can. Do you know anyone who can? You know, for elderly people, there's Age UK.
Yes.
And there are other organizations.
Yeah, there's the Mind.
But,
Mind.
Yeah.
There are church groups, organizations where people can, join and integrate with others. Okay.
Yeah, sometimes a person doesn't want to integrate. And if that person doesn't want to integrate, you have to understand that. But if you could find an individual who can help that person out of that situation,
absolutely.
Yeah. It's a great help. Yes, you can have church groups, but that doesn't mean the church group is there for you. I know it from personal experience.
Yes.
You ask and ask and ask, but they don't turn up.
Sure.
Yeah.
Yeah.
And a lot of organized organization, they will see that particular person because they're scheduled, I'll see you in 10 minutes. But 10 minutes is not enough for that particular person.
Absolutely.
Yeah, some people need
extra time.
Yes.
Extra time, at least to listen to them.
Is listening.
Yes.
That is the key thing. And giving the help that person needs. Because it may not be what you want, but it's what that person needs. It's always needs.
Mm.
Needs come before wants.
Okay. Thank you so much. So our people, you've heard it, okay? Anxiety can affect anyone at all. It can affect an adult, it can affect a child. So for adults, we are thinking of all the things we have to do. We're thinking about work, we're thinking about home, we're thinking about relationship with our spouses, thinking about the children. You know, there are so many things that can give us anxiety.
Yeah.
And also to the children as well, we don't undermine the fact that they are young. They still have things that can lead to anxiety, you know, on their own side, like their studies, being bullied at school, or one thing or the other. Okay, so once we realize these things, it will help us to manage our symptoms when it comes in. And don't forget your best point of call as well. If you don't want to speak to someone, you have your GP. Always go to them and see how they can help you out. And sometimes they can help to signpost you to these organizations that will be able to help you. And for another person that is listening to someone, or someone has anxiety and they've come to cry to you, please don't judge them. Don't stigmatize them. Don't, take their story out there, because that's part of what scares people from coming to friends or coming to open up. So they genuinely need help from you. So, and if you can't provide that help, please make sure you direct them appropriately. Yeah?
Because there must be trust.
Yes.
Yes. Once that trust is broken, it's very difficult to rebuild trust.
That's it.
You see, that person has to relearn how to trust, relearn how to walk again, relearn how to speak.
Yes.
Because most people who are burnout, they start a conversation and halfway the brain goes to sleep.
Yeah.
And speaking to somebody, especially people in a position, because the person has stopped, then they begin to criticize, Oh, I'm busy. Oh, don't do it to a person.
Yes.
Some time ago I had this friend who doesn't live too far away from me. And of course she came here one day and she was talking about somebody at work. And she was complaining that every time that person comes to work, that person is always ill. That person is always a headache, or always complaining of headaches. And so I said, if the person has a headache, she has a headache. Now, recently she came here to me, and when she approached us, from the time I saw her, I saw a different person. From her face, I saw something had gone wrong. So as she came in, I said to her, what happened? What's wrong? She said, oh, I feel so bad. So I said, what happened? Are you unwell? She said, no. This girl I told you about, she came to work this morning and she was complaining of the headaches again. So everybody left her. She left her on her own. And of course, she rests her head on the computer, against the computer. And, so they took no notice of her. When it was lunchtime, she was still, her head against the computer. So I said, and none of you went to her to find out. So when they went to her, they found she had died.
You see?
She died from a brain hemorrhage.
You see?
Yes, so I said, that is why the last time I told you the girl has a headache, she has a headache.
She has a headache. She's genuine. Because nobody will want to feign illness and keep feigning ill, all the time. So when people cry out like that, there's a genuine reason. Just don't always doubt.
Don't doubt a person.
Don't doubt, Please trust them and then get close to them. So if someone has gotten close to her, then she would have gotten treatment before whatever happened to her happened. But now nobody listened, and that was it. So
Yeah.
anyway, we just want to
So,
thank you for listening to us today, for watching us. Please keep watching, keep engaging, and also help us to share this as well,
yes.
because there are other people that would benefit from what we have shared today. So with that, I'm gonna say big thank you to our viewers, to our supporters, and also to our special guest today. We just want to say big thank
Yes,
you, ma'am.
thank you.
God
Thank
bless
you
you.
for trusting me and asking me, yes, to share.
Yes.
I'm quite happy to.
Thank you. Thank
Yes.
you. Thank you. So we'll be
Yes.
coming back to you guys again. So on behalf of a Well Woman TV, thank you. Thank you. Thank you.